Do you ever wake up in the middle of the night with a sudden, stabbing pain in your leg or foot? That kind of pain that grabs hold of your muscle and won't let go, twisting it tight like a rope? You're not alone. Millions of older adults, especially those over 60, report having frequent muscle cramps. These sudden spasms don't just hurt, they disrupt sleep, increase anxiety around bedtime, and can even make you fear simple movements. But what's really going on here? Are these cramps just another unfortunate part of getting older? Or could they be a message from your body warning that something deeper is wrong? To understand the answer, let's begin with the basics. A muscle cramp is an involuntary, sudden contraction of one or more muscles. It comes without warning, causes intense pain, and can last anywhere from a few seconds to several minutes. And even after the cramp ends, soreness and tenderness can persist for hours. Among people over 60, the most common location for cramps is the lower body, particularly the calves, thighs, and feet. These are what we call nocturnal leg cramps, and they often strike during sleep when the muscles are inactive and circulation slows. So why do they become more frequent as we age? The answer lies in the way our body changes over time. As we grow older, our muscles naturally lose strength, elasticity, and hydration. The neuromuscular system, how our brain communicates with our muscles, becomes slower and less precise. This can lead to misfired signals, where nerves tell muscles to contract when they shouldn't. And the muscle, once tensed, doesn't know how to relax. There's more. Older adults are more likely to be slightly or chronically dehydrated, often without even knowing it. Our sense of thirst diminishes with age, so we simply don't feel the urge to drink water as often as we should. Dehydration thickens the blood and limits the delivery of oxygen and minerals to the muscles, making cramps more likely. And let's not forget about minerals: magnesium, potassium, and calcium, 3 silent heroes in muscle and nerve function. Deficiencies in these minerals are common in older adults due to diet changes, reduced absorption in the gut, or interactions with medications. Diuretics, often prescribed for blood pressure and heart failure, flush out potassium and magnesium. Statins, used for cholesterol, have been linked to muscle pain and cramping in some individuals. Even asthma inhalers and some sleeping aids can contribute. Now let's pause for a moment and ask, when are cramps just cramps, and when are they something more serious? Doctors warn that while many cramps are benign, persistent, painful, or unusual cramping patterns can be warning signs. If your cramps last longer than 10 minutes, happen daily, or occur in unusual places like the arms, hands, or torso, it may be time to look deeper. Swelling, redness, or weakness following a cramp. Another red flag. Cramps that started shortly after beginning a new medication? Pay attention. If you have a history of chronic conditions like diabetes, kidney or liver disease, or vascular problems, your cramps might be signaling poor circulation or nerve damage. In rare cases, doctors have traced persistent cramps to serious conditions like peripheral artery disease, where blood flow to the legs is restricted, spinal stenosis, where nerves are compressed in the lower back, or even electrolyte imbalances caused by uncontrolled diabetes. So don't ignore them. What feels like a nuisance today could be a symptom worth investigating tomorrow. Now let's talk about what works, what you can actually do to prevent and reduce muscle cramps without relying on guesswork or gimmicks. The first step? Hydration. It's simple but often overlooked. Aim for 1.5 to 2 liters of water per day unless your doctor advises otherwise. And not just plain water sometimes. Adding a pinch of sea salt and a squeeze of lemon helps replenish sodium and minerals lost through sweat or medication. The second step is movement. Muscles need motion. Even light daily activity like walking, yoga, tai chi, or stretching helps increase blood flow and keeps muscles supple. If you spend long hours sitting or lying down, you're at higher risk of cramping because inactivity allows fluid to pool in the lower limbs and muscles to tighten up. A short walk after dinner, a few standing stretches during the day, or simple leg movements in bed can do wonders. The third step, stretching before sleep. 5 minutes of slow, deliberate stretches targeting the calves, hamstrings, and feet can significantly reduce the frequency of nighttime cramps. Try standing calf stretches against the wall, seated forward bends for the hamstrings, or towel pulls for the feet. Next comes nutrition. Your muscles depend on the right minerals to function properly. Add more magnesium-rich foods like spinach, pumpkin seeds, almonds, and black beans to your diet. Eat bananas, oranges, and avocados for potassium. For calcium, go with low-fat dairy, leafy greens, or fortified plant-based milk. If you're not getting enough through food, your doctor may recommend supplements, but be cautious, especially if you have kidney issues. What about medications? Review them carefully with your doctor or pharmacist. Bring a complete list including over-the-counter drugs and supplements, and ask whether any of them could be contributing to your cramps. Sometimes, adjusting a dosage or switching brands is all it takes to make the cramps stop. Now let's address the remedies you've probably heard about. Tonic water, for instance, contains quinine, a substance that was once prescribed for cramps. But due to side effects like heart rhythm issues and allergic reactions, quinine is no longer recommended. Pickle juice? Surprisingly, it might help, but not because of electrolytes. Research suggests that vinegar in pickle juice triggers nerve receptors in the mouth and throat that send a signal to the spinal cord to shut down the cramp reflex. It doesn't solve the root problem, but it may provide quick relief during a cramp. Bananas? A good long-term source of potassium, yes, but don't expect them to work like magic mid-cramp. Let's be clear, none of these remedies are cures. They might help some people occasionally, but they don't replace hydration, movement, mineral balance, and medical guidance. When should you see a doctor? If cramps are interfering with your sleep, your mobility, or your peace of mind. If they're getting worse, spreading, or changing in character. If they follow a pattern that's new or alarming. Or if you simply feel that something's not right. A basic blood test, a nerve conduction study, or a vascular scan could uncover a hidden issue, and early detection always leads to better outcomes. And while these cramps might seem like nothing more than physical discomfort, the truth is they can affect your mental and emotional health too. Many older adults who suffer from recurring leg cramps at night report increased anxiety before bedtime, dreading the pain they know might be coming. Some begin to avoid stretching or moving too much during the day, afraid it might trigger another painful episode. This fear can create a vicious cycle. Less movement leads to poorer circulation, which in turn leads to more cramps. For people who live alone, the issue becomes even more serious. Waking up at 2 a.m. in pain, struggling to stand or walk it off, can trigger panic. And without someone nearby to help, these nighttime cramps can quickly become traumatic experiences. We don't talk about this enough. But your fear is valid. Your discomfort is real. And you deserve solutions that work, not just temporary fixes. One thing many doctors emphasize is the role of sleep posture. How you sleep, your leg position, the support of your mattress. Even the tightness of your sheets can affect blood flow and muscle positioning. Sleeping with your legs too straight or tightly tucked can shorten the calf muscles and increase your chances of cramping. Try sleeping with a slight bend in your knees, or placing a soft pillow under them to maintain gentle flexion. If your mattress is too firm or doesn't support your hips properly, consider using a mattress topper or speaking to a physiotherapist. You might also want to keep a symptom diary. Write down when the cramps occur, what you ate that day, whether you were active or sedentary, how much water you drank, and if you felt stressed or anxious. Over time, patterns may emerge. Maybe they're worse after a salty meal, or on days when you skipped your afternoon walk. Knowledge is power, and your own body is your best teacher. And here's something few people talk about: breathing. When a cramp strikes, your first instinct is to hold your breath and tense up. But shallow, panicked breathing actually worsens the pain. Try this instead: slow, deep breaths. Inhale through your nose, exhale through your mouth. Focus your attention on exhaling fully. Deep breathing calms your nervous system, improves oxygen delivery to the muscles, and helps your body relax faster. Now let's talk about something just as important as muscles, your circulation. Every time your heart beats, it's pushing oxygen and nutrient-rich blood through your arteries, all the way to the tiniest capillaries in your legs and feet. But in many people over 60, especially those with diabetes or a sedentary lifestyle, circulation becomes compromised. The blood moves more slowly. The vessels become narrower. The tissues don't get the nutrients they need. And when that happens, muscles don't perform like they should. They tighten more easily, and they take longer to recover. Doctors often refer to this as vascular insufficiency, and it's more common than you think. It doesn't always show up in obvious ways. Sometimes it's just the cramps. That's why regular movement isn't just about burning calories. It's about pumping fresh blood through the places that need it most. Something as simple as wiggling your toes, flexing your calves, or doing heel lifts for 30 seconds at a time can dramatically improve lower limb circulation. Another area that deserves more attention is your nerve health. The nerves in your legs are responsible for triggering muscle activity. If those nerves are pinched, damaged, or inflamed, whether by a spinal condition, diabetic neuropathy, or poor posture, the muscle may cramp even when it's not doing anything wrong. This is why some patients benefit not from stretching, but from chiropractic adjustments, physical therapy, or targeted nerve treatments. And yes, stress plays a part too. When you're anxious, your muscles naturally hold more tension. Your breathing becomes shallow, your blood vessels constrict, and your whole system becomes more reactive. It's no coincidence that cramps tend to strike when we're overtired, overwhelmed, or emotionally strained. Relaxation techniques like meditation, journaling, or even a warm bath before bed can help regulate your nervous system and reduce muscle excitability. So how do you put all of this together into a plan you can actually stick to? Start small. Week 1. Increase your water intake by 1 extra glass per day. Add 1 new mineral-rich food to your lunch or dinner. Do a 3-minute stretch before bed. That's it. Don't try to fix everything at once. Week 2. Schedule a 15-minute walk after dinner. Review your medications with your pharmacist. Begin tracking your cramp episodes in a notebook or app. Week 3. Experiment with bedtime posture. Try elevating your legs or adjusting your pillow setup. Add a magnesium supplement if your doctor agrees. Week 4. Reflect. Are your cramps less frequent? Do they hurt less? Is your sleep improving? Celebrate small wins. Stay consistent. Build from there. This isn't about chasing perfection. It's about progress. And most importantly, remember that your body is not working against you, it's working with you, asking for your help, your attention, your kindness. The pain of a cramp isn't just a nuisance, it's communication. And now you're learning how to listen. And if you're someone who's been silently living with these cramps for months, maybe even years, it's okay to feel frustrated. It's okay to feel like you've tried everything. But please don't give up. Your comfort is not a luxury. It is a basic, rightful part of aging with dignity. You are not weak for asking questions. You are not a burden for needing answers. In fact, seeking clarity about what your body is going through is one of the most powerful things you can do for yourself and for the people who love you. Because when you take care of your pain, your energy returns. Your sleep improves. Your mood lifts. You become more present, more hopeful, more engaged in life again. And if you're a son, a daughter, or a caregiver reading this on behalf of someone older, I want to speak directly to you. Your support matters more than you know. That gentle reminder to drink more water. That moment you walk with them after dinner, that encouragement to speak to a doctor, these small actions can change everything. Sometimes the greatest gift you can give is simply this: presence, patience, and the belief that things can get better. In a world full of loud voices and complex advice, the truth is often quiet and simple. Listen to your body. Respect its signals. Support it with the essentials: water, movement, rest, nourishment, and care. Don't chase fads. Don't wait for symptoms to become emergencies. Start now, gently, but consistently. Because you deserve to walk without fear of sudden pain. You deserve to sleep through the night without interruption. You deserve to stretch, breathe, move, and live fully no matter your age. And if this message has resonated with you, if you've seen a piece of yourself in these words, don't keep it to yourself. Share it with someone who might be going through the same silent struggle. A friend. A parent. A neighbor. Sometimes, all it takes to change a life is a bit of knowledge passed from one heart to another. Thank you for taking the time to learn about your body, your health, and your power. Keep going. Keep growing. And always remember, aging may be inevitable, but how you age is in your hands.